A coalition of healthcare workers and community advocates wants to see a change of course in the state's response to the coronavirus. In recent weeks, there has been a general expansion of reopening along with new appeals to personal responsibility for precautions. But the coalition said there should also be more attention to the needs of essential workers and renters facing evictions. To tell us about the message from the coalition is one of its members, a community organizer with Boston Community Health Initiative, Noel Sanders. Thank you very much for being with us, Noel.
Thank you for having me.
Noel, before we get going, can you tell us a little bit about what you're trying to do in your organization?
Sure, yeah. So the Boston Community Health Initiative, we're a really new organization, and we're kind of a collective of local patients in the area. We focus specifically in Dorchester, Roxbury, Lower Roxbury, and we're a group of people who are basically obviously citizens and community members who've noticed, just from anecdotal experience, kind of reflections of what we already know about systemic racism being present in the healthcare system, which obviously COVID is one of the largest highlighters of that we've had in recent times. And so what we're doing is we're coming together as patients, as members of the community, to kind of hold hospitals, local hospitals, and healthcare providers accountable for these things. And part of that also comes from recognizing that even though individual responsibility is important and institutional responsibility is important, so many things with COVID-19 are structural on a legislative, local, federal level. And so it's really important to have not only protections on a smaller level, but on a larger level that allow us to work safely, live safely, and also consider the health of our neighbors as well.
Well, you've described areas that have been hit harder by the virus. We've seen the figures in Boston, especially the Latinx population has disproportionately been infected, but also the Black population. What would you like to see the governor do differently to help those people?
Yeah, I mean, so many things. I mean, probably one of the biggest things that would be really beneficial is to codify and systematize COVID regulations for workplaces. That's something that we see because a lot of Black and Brown members of our community they do have jobs that are considered essential workers. And we're also finding that, just kind of in the Mass Coalition of Health Equities findings, we know of 60 workers who have been laid off for contracting COVID-19 and concerns about spreading. But at the same time, people often don't have the freedom to just not go into work. I mean, people obviously are being hit financially. We're seeing moratorium, the housing moratorium, evictions rise. And so it's really important to be able to work safely and live as safely as possible. And we can't necessarily trust employers to enact those protections. And so we would like the governor to institute on a state level regulations, working with employers, workers, unions where applicable, to make sure that workers are protected and have enough sick time that they need, work mobility leave, and also PPE at work that's provided free of charge, and the ability to call in if they're experiencing COVID symptoms.
Well, there are a lot of workers who might take paid sick leave for granted, but the population that you're looking at, is that the case for them?
No, I mean, it's very interesting because a lot of times paid sick leave obviously expires and it often accrues on a rolling basis. But most of the time, people who do, even if they have access to paid sick leave, are not going to make as much money while using that sick leave as they would working, especially if they're only able to afford rent, the rising cost of rent in this area, and food by going into overtime, which obviously you can't really do on sick leave. So, I mean, a lot of the patients I work with, for example, not only are they literally praying for sick leave because it's the last option that they have for their health in order to get better so they can go back to working extreme hours, but a lot of people feel like if they had sick leave, they would either use it to protect themselves or, as is increasingly needed, provide childcare, which they don't necessarily have with schools not opening uniformly across the state.
Well, you've described the part of it that's their problem, but what about the rest of us? Because if these same people are going to work, they're circulating, couldn't that be a problem for other people as well?
Oh, absolutely. I mean, when you think of food service as the first example that comes to mind, but when you think of any high traffic workplace where there's a lot of customers, if you will, interacting with staff, we even know through contact tracing, those are kind of super spreading locations as well. And so it's not just a risk for the individual workers, which obviously is a paramount concern, but it spreads throughout an entire community, literally within an entire neighborhood, depending on how many people are going into a restaurant, for example, or a store, or leaving, even if you think about rideshare services like Uber and Lyft, even though only one rider is typically allowed in those, if there's a sick driver, for example, that's potentially coming into contact with hundreds of people per day, but the person doesn't necessarily financially have the ability to sequester, quarantine, or take time off for the 2 weeks of contagiousness with COVID-19, for example.
Well, the medical experts say an important way to slow down the spread of the coronavirus is to look for the clusters. So what does that mean with the kind of testing that we need to see, especially the testing that we're not getting already?
Yeah, well, the first thing, and this is something that the governor could directly do, is to increase access to testing and decrease the turnaround time of test results, which right now, those things are directly tied with the level of insurance that you have and the locations you're living in. So for example, I mean, I'm in Jamaica Plain and I live kind of right near Brookline, which even I've observed has a lot of testing ability, quick turnaround. But if you're in Dorchester and Roxbury, especially even farther out towards Mattapan, kind of moving towards Milton, like out further in that direction, you can have to travel miles potentially to get to a testing site and then often have to wait an extended period of time to get those results back, which with the lack of public transit and the difficulties even in the high level of exposure in public transit, which is something you and I were talking about, a lot of people are still working while potentially having COVID-19, but aren't even aware of their diagnosis yet. And so they can't even take those precautions. They can't even say to their employer, I know for sure I've tested positive. I completely need to have time off, because a lot of employers won't necessarily, if you're feeling sick, they won't necessarily deal with it or accept it unless you can actually provide a real test result for them to see.
By the way, what about transit? I know the trains and buses aren't as empty as they were a few months ago. The T has promised to provide more service where it's needed. Are they doing enough of that?
Absolutely not. No. And I do notice, even in my own observation, people are really conscious. Like people are often taking individual responsibility. They're distancing from themselves as much as possible. But when you're in, think about the Green Line, a packed train car, if there's 30 people in there, there's no way people are 6 feet apart or even more, which would be ideal now that we know about airborne transmission. So honestly, in order to make that a rule, you would need to have more trains in circulation. You would probably need to have train operators paid a lot more. And that's something that would have to be enacted legislatively on a state level from the governor's office. That's something where even the best intentions, thinking about rush hour, we simply can't do as individuals on our own.
I want to ask you about the main housing problem that's looming right now, because the moratorium on evictions expires October 17th. That doesn't mean everybody's going to be evicted within 10 days, but on the other hand, the pandemic's not going to end in 10 days either. What needs to be
Right.
done about that?
Right. Well, in the immediate, right now in the State House and Housing Committee, we have the Guaranteed Housing Stability Act, which people at City Life, a lot of housing advocates are supporting, and the medical community as well. It's called House Bill 5018. And it would not only protect tenants and small owners and landlords financially from the impacts of eviction, but it would make sure that people, as much as possible, have a roof over their heads to stay safe, obviously, but also to quarantine safely and to socially distance. And if we have a situation where we have the intersection of everything we're seeing now with the eruptions of race popping up, along with COVID-19, which is a crisis in itself, combined with people not having a place to stay, you'll have people, it just increases crowding, it increases people coming together and accelerating the spread of the virus, which we already know is going to happen anyway with the second wave that we're estimating will come in January or so.
What about the cost of workplace safety? Because this could mean new HVAC systems, new filters, and sometimes you get buildings with windows that have been stuck for decades. Is this something that can really be fixed within a matter of weeks?
Personally, I mean, I'm not an economist, but I'm not really sure if it can be. I mean, obviously, a lot of buildings in Boston are old, and a lot of buildings have HVAC systems dating to the early 2000s, just structurally. So it's not necessarily something that can be done quickly, but from what we know about the COVID-19 crisis, which we're honestly thinking will continue to peak well into 2021, we certainly have quite a bit of time. And the only way to decrease that time period of high contagion and high mortality rate is to do what we can now. I mean, it's honestly better even if we start with businesses locally, small businesses. Sure, not every landlord or small homeowner would be able necessarily financially to do those renovations, but even impacting places where there's high traffic, lots of people, even that would be quite a bit helpful.
I want to ask you about the way we calibrate risk right now, because we've been going on the percentage of positive test rates. And the figure that's being used, it includes, for example, a college student who was required to be tested once a week and who maybe is not infected at all. That changes the numbers in a way, makes them look lower. Is that the right standard that we should be using now?
No, I actually don't totally know much about the correct standard. I know that some members of the Mass Coalition of Health Equity do, and they spoke at our press conference about it. And they're, amazing clinical researchers. But I can say that it's a highly political decision to suddenly switch using metrics that also randomly also present better than the metrics that we used to use, which were much more comprehensive. And that's even something that I don't know all the ins and outs of it, but it's really clear that the attempt is to minimize the impact of COVID, especially in Massachusetts, which Boston, of course, was one of the epicenters of the nation for COVID-19, especially earlier in the year. So it's definitely, oh, sorry.
Yeah, no, please continue.
Oh, no, I was just going to say that's definitely important to use testing results that accurately affect every demographic and every high level infection rate in the city, and that aren't meant to kind of minimize a problem that isn't actually decreasing at all.
Noel, I want to also ask you about immigration and how that's enforced and how that affects what's going on with the pandemic. What should be done differently?
Sure, well, definitely we should support the Safe Communities Act, which is currently in the House. It's House Bill 3573, and the Work and Family Mobility Act, which is House Bill 3012. And those would not only allow undocumented immigrants increased workplace safety and access to medical and public health resources, but it would also allow them to go to work without fear of being picked up, if you will, on their way, and would definitely comprise protecting a substantial part of our essential frontline workers, especially in Boston, Dorchester, Roxbury, and Chelsea.
Thank you very much for being with us, Noel.
Thank you for having me.